Instead, we have the opportunity to make a habit of empathy, to recognize ourselves in each other.
I'll tell a personal story about my mother, and she recently had a major illness a few months ago, and she was hospitalized at Kaiser, and I think the care that she received there was very, very good. The physician who was her caretaker at the time, he would come by 3 or 4 times a day, and her physician who worked with her when she was admitted was very, very gentle, very understanding. He asked her, how did she feel? Did she have any questions? Did she understand what he had said to her? And when I go to the doctor with my mother, and a lot of times for myself, I don't tell them that I'm a nurse. I just sit there. I'm just a person. I'm there with my mother. She's getting care. So I saw that it wasn't a put on for the fact that I was, in the field as a nurse. It was because he was concerned about how she felt, what was going on with her, and how he could help her get better.
I know, this is great. I'm always behind the camera, so I never get in front of it. So for me, it's that I have a really great GP or internist, and it's a female doctor, and she really goes out of her way to spend time with me and with my partner, who's also a patient with her. And when you do the first meeting with her, she spends like an hour just sitting there listening. It's like, how's your sex life? What's the history of your family history? She wants to know, how's your stress level? And she just wants to know everything about you and really kind of be there for you. And every time I go to see her, it's like just a pleasure. It's just so great because of just that kind of that warmth that she kind of radiates. So, and I know she's actually struggling as well with, she's an independent doctor. She's trying to create this caring healthcare for her patients, and she's struggling financially as well because she's not doing that quick and so I really appreciate that that she's there for us.
And when I went in, she said, "Oh my God, you've been putting up with this for how long? Well, we can solve this in 5 different ways. You've got all these options. So get dressed, come into my office." And she brought me in, and she went through. We could do this, and here are some of the positives, and here are some of the negatives. And we could do that, and here are some of the positives. And she just went through. I had another condition which affected my ability to do some of these. She said, "Let's call your other doctor right now." She got on the phone, started talking with the doctor who was treating me for the other thing. And, they had this conversation. She put on speakerphone so I could hear both what they were saying. And, they agreed, they said, well, this one's probably not a good option for her at this time, but this one probably would be okay. And then, again, she just said, don't make a decision today. Go home, talk it over with your family, decide what you want to do, and give me a call. And then the treatment that I got from her was really great too. So it was nice.
Since there's so many stars, it's kind of like the human spirit. It kind of comes together, and it's to a point where you don't know where, in terms of empathy, sometimes where you don't know where you stop and the other person begins, kind of a quality. And so there's kind of a warmth for me in that, the coming together instead of being totally separate entities out in the universe. So.
One of the things that the whole training is supposed to be about is getting beyond just the technical aspects of doctoring.
Don't have things,
various kinds
these basic needs being met for everyone in the country. You do pay in different ways.
Right, but kids are developing adult onset diabetes, so it's type 2.
Yeah, type 2.
So Leon, what do you have to say?
Well, I'm mostly listening, being as I came in the middle, and I was trying to relate some of these things to the theme of empathy.
What does it take?
A couple of things came to me about that. One was when you were talking about the Democrats versus Republicans, and having a majority, having almost a foolproof filibuster-proof majority. I was thinking about the empathy for people who have opinions different than your own, and is Obama he sometimes tries, I think, to reach out and have empathy for other positions, but
Oh, definitely, I think he does too.
I think there's a conflict between that and wanting to get your own majority.
Part of what we have to do is just be more accepting of the fact that we have to pay a little more taxes to have some of these benefits that we need.
Looking at the world that says that there are certain things that everybody deserves to have.
That's
Everybody
right.
deserves to have those things.
Right.
And we're a better society as a result of that.
And it shouldn't be profit driven.
Right.
More for less.
Be willing to compromise a little.
The industrialists, you
Maybe
know,
a lot.
there's healthcare, that's your problem. You know what I mean? I don't have anything to do with that, that's your problem. See, that kind of
They don't have to.
way of thinking, you know?
Corporations
That's great.
have shareholders as if they
How, in our present system, link or integrate empathy with capitalism, empathy and universal healthcare.
Just the way healthcare has become like a factory sort of thing. Doctors take as little time as possible to get to know their patients, and a lot of you don't know your patient as a person. People trying to change the very nature of atmosphere in a hospital, for example, and caring, empathic relationships both among staff and between staff and patients and doctors and nurses. That's the kind of healthcare I long for.
Subject matter, you know, doctors have like about 15 minutes per patient. You know, they're like running them through like an assembly line, you know, and the kind of cognitive and the kind of errors they make in their thinking, etc. He goes into the complete structure. I mean, this Dr. Groopman he makes you see what's really going on.
What concrete action can be taken in your specific current situation?
Oh, okay, some of mine kind of lean toward what other people have said so far. But I guess one I can bring out is respect and how you're treated. So when you need to go to the doctor, how do you feel that you're being treated respectfully from beginning to end, such as getting an appointment, registering at the appointment? So every encounter that you have as part of that visit, do you feel that you're treated in a respectful manner? Do you feel like you're listened to? Do you feel like you're taken seriously? Do you feel that your concerns are and your needs are being met? And that's just from a routine appointment, or if you have a problem that you need to see your doctor about.
Let's see, can a for-profit healthcare industry be empathic? And if everyone had their healthcare needs met, we'd be a more empathic society. That goes back to the security discussion we were having earlier.